we are here today with Dr. Clement. He is in charge of the IAT clinic, and it is immunoaugmentive therapy. And if you could tell us a little bit about what that means.
Yes, it's our treatment of cancer is to use the patient's own immune system and try to make it function as it does in people who don't have cancer or who are able to control cancer. So that is why it's called immunoaugmentative. We're augmenting the immune system. We're trying to make the patient's immune system resemble that of a patient who doesn't have cancer, because we believe, and most doctors agree, that people probably develop cancers several times in their life, but they're able to control them. And when that system goes wrong, then you develop a cancer that is going to start taking over control of you. So that's the immune augmentation, is to make your own immune system work for you and against cancer.
Okay. Well, in your opinion, when an individual receives the news that they have cancer, anywhere from stage 1 to stage 4, what is their best course of treatment, and when should they start?
Well, the sooner they can find out something's wrong, and that can only be done probably by going to a doctor, is as soon as you know you've got something wrong, is to try and find out what it can be done. And as Dr. Burton, who we are following here in the treatment, said, the only people who have really got any control over cancers, particularly solid tumours, are surgeons. So that anything that is affecting you, if it's a solid tumour, in other words a lump you can feel or something that you can identify, the first thing you must do, if it's possible, is have it cut out.
So you do think that surgery in this case? Surgery
is always preferred to everything else.
Okay, and what about radiation chemotherapy?
Well, although we have been working here, people think we are against chemotherapy and radiation. We're not. We're against the wanton misuse of chemotherapy and the misuse of radiation. There are a lot of conditions which are controlled. At the moment, children's cancers have been finely controlled by medication, which is chemotherapy. But most of the adult solid tumours, in other words, lumps that grown-ups have, don't respond very well to chemotherapy. So that we're very interested in getting hold of people when they have conditions which are not going to respond to chemotherapy. And there is unfortunately a great trend of treatment by the book. Would that be the conventional Western type of medicine? Yes, you go in and you have a lump in your tummy or something or other, and the surgeon goes in and takes out your ovarian cancer, and the oncologist says, oh yes, right, now let me see, ovarian cancer, that's page 8. Okay, carboplatin and taxotere, and the patient has that treatment willy-nilly, and 8 weeks later has no hair, lost 20 pounds, and possibly has had no benefit at all. That is the kind of wanton misuse of chemotherapy we're trying to prevent.